Okay, right. So once more, good afternoon, everyone. Welcome. Welcome to HLED 100, First Aid and Occupational Health and Safety. So we're gonna start off with first aid. I know typically previously other lecturers would have done the occupational health and safety side of it and then go to the first aid. I prefer to start with the first aid and gradually work our way into the occupational health and safety. It has worked pretty well with the previous class, so I'm hoping that the same thing can happen with this group. All right. So when we're looking at first aid CPR AED, we need to understand our role. Basically, what do we do? Okay. And at this point in time, what I'll do is ask you guys. So I'm open for suggestions now. Let me hear you guys. What do you think? So let's leave out the provider. Let's look at these two words. First aid. What do you think first aid is? And I don't want these long, elaborate explanations. I want something that's simple and straight to the point, right? One or two sentences, as the case may be. So let me hear you guys. What do you think first aid is? Anybody?
The first help, medical help or attention that someone could give to someone in an injury or in an emergency.
Right. Okay. First help or first medical help to someone, right, who suffers an injury. Okay. Anybody else? Anybody else? Anybody else? I'll just go and mute for about 5 seconds, right? All right, so back to the slide here. All right. Anybody else want to make a shot at it? What is first aid? I'm gonna start to call names. Make a guess. You guys doing environmental health and safety? You guys doing MLT? All these programs. Right. So here we go again. I need to mute. Yes, guys. Let me hear you. What is first aid? What do you think first aid is? In your own words. And don't tell
So
me. Uh-huh. Go ahead.
it's like immediate care given to someone who falls sick or becomes injured.
Right. That sound like you went online. You went, you went online and get it? Tell me the truth. Come on.
Yeah, I did.
All right, no problems. So what you'll find happening, and I'm okay with that. I have no problem whilst class is going on, and when I ask questions, you very quickly go on your phone or you're on your laptop, you minimize your screen, you go, you do some research, and you get. I am okay with that. At least you're getting the information. All right. However, there might be some times where I'll ask you not to do that. And I hope that you respect it. Remember, I am not, you're not in front of me. The most I could ask you to do is to turn on your cameras. But again, that would be few and far between. It's just a matter of that level of interaction and trust and respect, right? So yeah, anybody else want to add to that? Come on, guys. Everybody don't rush
Fir-
on at the same time.
First
Yes,
help or first care.
that's right. First help or first care. Anything else anybody want to add to it? Nobody? All right, so let's break it down. You're all correct. You're good. So let's break it down. As the name implies, first, before everything else, aid, help, or care. It is immediate care and stabilization to give unto someone who is in need of this. Okay. But one of the things we must be mindful of when we're providing care for someone is we do not become a patient or a victim. Okay. So, right. So typically, this program is from Emergency Care and Safety Institute. I'm an authorized instructor from ECSI. All right. And looking at first aid, we also must be able to understand. Now, it's really good for us to be able to understand injuries and illnesses, right? And a lot of times, what you see on the television, what you see on TV, or what you see online, um, social media, and all those things, um, a lot of times you might see worst case scenarios. Someone die, or somebody in cardiac arrest, start CPR, the person miraculously regains consciousness. The heart starts back beating, they regain consciousness, they hug up whoever, they say thank you, and everybody goes about their business, and life goes on. In reality, it doesn't work that way. Okay, so first things first, most injuries and sudden illnesses do not result in death, but rather you may have hospitalization, you may have treatment at the various emergency department or the physician's office. Now, in the US, you would see emergency department or emergency room. What do we call it in Trinidad? When you're sick and you go to the hospital, where you going to? Anybody knows? Or everybody going to the private doctor?
Accident and emergency.
Accident and emergency, commonly referred to as what? Somebody
Casual.
else.
E.
Casualty, right? And this is where we bring the differentiation here to Trinidad and Tobago, right? And I'll get to my colleagues, my Caribbean colleagues in a little bit. So it is called the accident and emergency or the casualty department. So my colleague in Jamaica and my colleague in Antigua, what is it called in your country? Same thing or it's different?
Same thing, casualty.
Casualty, okay. And Antigua,
Yeah, I'm living in Antigua, same thing.
okay.
So Jamaica and Antigua would be the same.
Okay, right. So basically it's coming from the fact that the British had so much influence in Trinidad and Tobago and the Caribbean islands in setting up all these systems, right? So, yes, everywhere in this program you see emergency room or emergency department, it is the accident and emergency or the casualty department we're referring to. Okay, so not everyone dies. Not every situation is life-threatening. Some situations might very simply require treatment from the first aider, and that's it. But if you're at work, so let's use our colleague who is the safety warden. If you're at work and you call upon to render aid and you provide care for the patient and the person does not require hospitalization, then are you required to document it? Let me hear you. Well, actually, before you answer, let me hear everybody else. So you're at work, you are a warden, you're called upon to assist somebody to provide first aid. Let's say the person got a minor nick on the right on the wrist, the right wrist, and all you did, you just went, you clean it, and you put a band-aid on it. So you administer first aid. You don't need to be hospitalized for that. You put a band-aid or a plaster, right? Um, do you or are you required to document that? Tell me, what's your opinion? Anybody?
I
Well,
think so. I think so. I don't know if
right,
I'm right, but I
right. So
believe you
one person
should.
say yes, good. Somebody else? Come on, guys. Let's get the participation
I
going.
think so as well.
You think so? Okay. Anybody else?
Yes, I think you should.
Right. So, yeah, you're correct. When we're looking at our OSHAC and um reporting of incidents and documentation of incidents, accidents, all those things. Typically, organizations are required to have a lost time record log, a first aid register, all those things, right? So, even if it is something as simple as administering a band-aid for someone at work, then you're required to document it because you would have administered first aid care. So on the screen here, this little triangle is called the injury pyramid, right? And typically what it does, it shows you the number of situations and cases where persons, workers are treated and the severity of the condition. So you would see the majority of situations are treated by first aid providers. Okay, so it ties right into most injuries and sudden illnesses do not result in death. Okay, you would have a fewer number of cases requiring treatment in the A&E or the doctor's office, but these may actually be more serious cases. Patients may require some stitches or they may require a cast for a broken bone or a sling and sword for and resetting of a dislocation and those things, right? Or the person may be requiring treatment for difficulty breathing or an asthma attack, as the case may be. But now, whatever is the situation, it is a serious situation that requires treatment outside of work in a medical facility. Further up, we have fewer cases, but more serious again. Injuries that require hospitalization, such as, let me hear you, what cases, medical or trauma, you think someone will require hospitalization? Anybody?
A severe motor vehicle accident.
Yes, a severe motor vehicle accident. That's one. Okay, thank you. Somebody else?
Degree burn.
A what?
A third degree burn.
A third degree burn. Yes, you're quite right. Somebody else?
A severe allergic reaction.
A severe allergic reaction. Yes. Good.
It's a case of choking.
Choking. Yeah. Of course, remember with the choking, the first aid is crucial here because you would need to get that object out and then, of course, have the person assessed by a physician. But we're talking about a lot of traumatic situation. What about the medical conditions? What medical conditions
But
you think? Huh? What's that? What?
that's it.
I think I have a
Like
hearing
a heart
problem.
attack. A
A
heart
heart
attack
attack.
was
That's right. Good. Cool. A heart attack. Somebody else tell me another condition.
Seizures.
Seizures. That's right. Good. What else? Let's get one more, or maybe two more.
A stroke.
A stroke, heart attack, seizure, stroke. Yes. Good. So we'll stop right there. So, of course, these are very serious conditions, and they require hospitalization for a period of time where the doctors now can do the necessary interventions and, of course, develop a treatment plan based on their diagnosis. Okay?
Okay, sir.
Right. You guys with me so far? I just
Yes, sir.
muted the cough. And you're gonna see me doing that over and over as the cough continues, right? Um, and of course we have the fewest cases that result in death. And if you notice, when you look at the pyramid here, largest number of cases are treated by first aiders. So that tells you the importance, how critical first aid is when we're on the job, when we're at home. Okay? So this sentence here, it is better to know first aid and not need it than to need it and not know it. So remember I was telling you earlier, knowledge is power. Remember I was saying that? You guys remember? Tell me.
Yes, sir.
Yes.
Right. So it goes back to having the information at your fingertips. Okay, so whoever created the group, thank you very much. Nice. Right. it is always to your benefit and to the patient's benefit to have that knowledge and that skill. The knowledge is one, but having the skill to be able to practice and put into effect what you have learned makes a difference in people's lives. I worked as an EMT on the country's ambulance service for just over 5 years, and for some of you guys, that may have been before you were born. Yeah, or just around the time. Yeah, or just around the time when you were born. Wow, I am definitely old. But anyway, so I worked on the country's ambulance service from 2000 until 2005 and into 2006, and we've seen a lot of situations. And I am grateful for that knowledge that was imparted on us because I take that skill anywhere I go. Okay, I can assist persons, provide guidance, all those things. So this is going to be a very beneficial program for you guys. The goals of first aid, we have 4 of them listed there. The number one goal is to preserve life. What is the absolute worst thing that can happen to someone? We go back to the pyramid, the top there. What is the absolute worst thing? Somebody need to say it.
Death.
Death. That's the absolute worst thing. So our first goal is to preserve life, to keep the person alive. Whatever we are doing must be geared towards keeping the person alive. So even if you're afraid of blood, you see blood on the ground, you start to get all woozy and dizzy and all that other stuff. So you know you like can't interact with the person, I can't touch the person. But you know what you could do? You could step back. You could turn away so you're not seeing it and you could call for help. So you're playing a role in getting providers there to help manage the patient. If you could stomach it and manage to assist the person, then hooray, happy, thank you for that. But if your goal, your first goal is to preserve life, keep the person alive. Whatever measures you are implementing to stabilize and assist the person usually involves, once it's the injury is stabilized, or you've managed to get the medical condition under control, all within the boundaries of your training, it helps to alleviate suffering. So the person was choking, you did the abdominal thrust, the object is expelled. Now the person can be on the road to recovery. You've helped to alleviate the suffering. And whilst doing that, it ties straight into the third one here, preventing further illness and injury. Okay? Whatever you're doing should not cause further harm to the patient. Now, unfortunately, sometimes based on the patient's condition and the patient's location, we may be unable to prevent further injury because we may have to employ, let's say, a situation where the person is in a burning building and they're injured. And at that point in time, you employ an emergency move. Or let's say they're in a vehicle that got into an accident and in trying to get the person out of the vehicle or trying to render aid, there's a possibility of further injury. Unfortunately, not every time is going to be 100% clear cut. All we tell you is try your best, give it your best effort. Okay? And by employing the necessary stabilization and getting professional help to the scene to manage the patient, to transfer the patient to a facility or to additional medical care, you are also helping in the recovery process because once the condition gets stabilized, it gets managed. Now the doctors will assist in charting out a program for the person to be well on the road to recovery. Sometimes it may require surgical intervention, but it all starts with what you are doing, the foundation and the basic. Okay? We okay with that?
Yes, sir.
All right, moving on. Okay, so let me just Mute here. Just gonna get some water here. Just give me a second. So you guys could read this and we'll chat about it shortly. I'm back. Yes. So one of the initial parts, and a very important part actually, of being a first aider is being able to recognize emergency. And we have here some factors that will help a first aider recognize an emergency situation. So we have the severity of injury or illness. Give me an example of a situation that, let's look at a medical condition, a heart attack, or a suspected heart attack. What's going to make you suspect somebody's having a heart attack?
Maybe if they collapse by holding their chest or whatever.
Classic description, yes. They collapse, clutching their chest or grasping their chest. What about an asthma attack? Somebody else.
Yeah, that's very severe.
Right. How would you
Unable to
know?
breathe,
How would you know?
Heavy wheezing.
Heavy wheezing. What is wheezing?
gasping for breath.
Gasping for breath. So wheezing is actually a high-pitched sound, right? That's produced because of the narrowing of the airway and the movement of air. It creates a whistling
Excuse
sound.
me.
Yeah. Hi.
Hello.
Yes, I'm hearing you.
Not that I knew what to do, but because I know the signs of a stroke,
Mm-hmm.
I was speaking to a mature person and she was like lifting up her hand to say something.
Mm-hmm.
And well, I've been around her a lot. So I realized that she wasn't lifting the hand and I realized she was dragging the foot with the same
Oh,
side with the hand. So I
right.
just call and tell them I think she have the onset of a stroke and it was really that.
Well, thankfully, you were there to be able to identify that, right? And
Yeah.
one of the things I'll tell you is for all the participants in this program this semester, we're going to learn about all those things. So you're going to take that information with you. So I'm going to commend you for that. Thankfully, you're able to spot this early. And remember, there's a statement. There's actually two statements we have in emergency care, pre-hospital care. If you don't have an airway, you don't have a patient. And when we're dealing with when we get to that point, we'll discuss it. But also, when we're looking at stroke, time is brain. And I'll ask you to keep that in the back of your minds when we start to talk about stroke. Time is brain, and somebody needs to remind me when we're speaking about stroke, and I'll explain what I mean by time is brain. Okay? All right. How close you are to the emergency scene and the length of time you are at the emergency scene. The longer it takes to get the person stabilized, definitely this person may have a very serious condition taking place. The person's distressed appearance or panic stricken behavior. You ever see that? Anybody ever see somebody looking like that? Anybody?
Yes, sir.
All right, somebody else. Let me hear somebody else. Anybody else ever see somebody looking like that? Outside of the hospital, let's say at home, on the roadway, or anything like that?
Yes, sir.
So you can actually, it's something that, all right, so let's step away from this program for a little bit. And let me just stop the share here for a sec. Come back to you guys. Right. So one of the things we do as human beings naturally, without anyone telling us, we form general impressions of people when we see them for the first time. Think about that statement and tell me if that is true.
Yeah, true.
All right, one person said it's true. Somebody else.
I also think it's true.
Okay. Anybody else?
Yes, it's true.
Right. Well, why is that? Anybody knows why?
It's a natural thing for our survival as human beings.
Right. So we just naturally see people for the first time when we just form a general impression of them. Now, in emergency care, that is crucial. That's critical because it can tell us if we go back to the slide, and I'll get back to the slides shortly. When we talk about a person's distressed appearance or their panic-stricken behavior, it's something that resonates with us as human beings immediately. Whilst we may not be able to describe it properly, I think everyone would be able to understand what I'm speaking about. And I'm sure at some point in time you have passed an accident and you see people looking depressed and down and sad. If you've ever been in the hospital, you see an ambulance come in or you see people there and naturally see how they look, or somebody coming in with chest pain. And I mean, I've seen hundreds upon hundreds of patients in my time as an EMT on the ambulance, displaying this type of appearance. So typically, this is a good indicator. Now, when we started EHS, Emergency Health Services of Trinidad and Tobago, now it's GMRTT, right? Global Medical Response of Trinidad and Tobago. They run the ambulance service here in Trinidad, but previously it was run by the Canadians, right? And a lot of people would try to fool us on the ambulance and try to fool the hospital staff by having this sick, depressed look on their face when the ambulance gets there or when they get into the hospital. And I mean, we could tell, we could figure it out when we do your vitals. I mean, when we do your vitals and we realize, hey, your vitals are within the normal range, and we go to the triage nurse and we say, hey, there's a situation with this patient XYZ, this is what's going on. These are the vitals. Immediately, the triage nurse would get an indicator of, well, okay. And sometimes we develop little codes to um hint the triage nurse, well, what's going on with the patient and those things, right? But I mean, I'm not there anymore, so I don't know if it's still in place. Okay, so let me get back up to the slide here. Right. Previously knowing and recognizing the injured or ill person, you know the person, you know the medical condition, the situation the person suffers with, and that gives you an idea. So you can properly predict or accurately predict. The scene conditions, sight, smell, sounds. Person pulled from a burning building. Motor vehicle accident, the vehicle hit a pole, there's a rollover of the vehicle. All right, guys. Again, I apologize. I need to take a pause. All right, guys. I think I'm doing you guys a serious disservice. If you could just bear with me for probably about half hour again, and we'll wrap up. I think I really need to visit the doctor again tomorrow. And she was good on. Okay. Stress, the scene conditions: motor vehicle accident, rollover, front end collision, burning building, uh, the presence of a lot of blood on the ground, vomit on the ground. Those things. Looking at the scene, um, it can give you an impression of how severe a situation the person might be in. Okay. And of course, though, your mind starts to think about what possible conditions and experiences the person have. And now you start your chain of thought starts to head towards being able to manage and help this person. Of course, with all of that, we must look at, as a first aider, the option of making that decision to help. A lot of times, and we would have encountered it, and I know the current service provider, their staff encounter it as well, where people make a lot of excuses for not wanting to help. From, I could get in trouble, I could get infected, or I could get arrested, or those things. I just don't want to interact with judge the person, or I scorn the person, or check how you look in a guide and that kind of stuff. Really, really a lot of excuses. But if you make that decision to help, you have to understand there's a set process you have to follow. Remember, first it is voluntary. Unless you are at work and you have a duty to act, which we'll look at as well, right? So our colleague who is the warden here, the safety warden, wherever his job is, if you've been trained and you have accepted that role as a safety warden, then you have a duty to act when you're at work. With respect to your the floor you're on, the department you are in, once you're on duty and you are the respective warden for that facility at that point in time, then you are expected to respond. All other cases, first it is purely voluntary. You could help or you could step back. But if you make a decision to help, then you must see it through. Get help for the person, providing necessary stabilization, stay within the boundaries of whatever training you have. Sometimes it might be as simple as calling the ambulance and then taking the instructions from the ambulance on how to stabilize the person. Okay, but as much as possible, we want to be able to offer assistance to anyone in need, because I want you to consider and think about, if you or someone you love or someone you're close to is in this situation and requires assistance, then of course, you would want help for that person, you'd want help for yourself. Okay? So making that decision to help. Right, moving on. We've made the decision to help, but we want to take the correct actions or the appropriate actions. And it all starts with being able to size up the scene. What do I mean by that? Somebody tell me, what do you think sizing up the scene means? In your own words. Floor is yours.
Analyzing the situation,
Analyzing the situation. Anybody else? Anybody else? Tell me. Come on, guys, don't be shy. Place to make your errors is here. That's how we learn.
Making an
assessing.
assessment of the scene to see if you are capable of doing it or not.
Make an assessment of the scene to see if you're capable of doing it or not. Okay. Somebody else was going to say something. Somebody.
Assessing the severity of the injury or what is going on in front of you, how severe it is, if it is mild, if it's very severe, if you need to call the
Right.
ambulance immediately.
So what we're actually doing, we haven't gotten to the patient yet. We still at the if you want to use the term, at the border or the entrance of the scene, right? And when we're talking about sizing of the scene or doing a scene survey as EMTs and paramedics and first responders or EMRs like to call it, we're looking at the scene or the location where the patient is for clues, for guidance. What is this guidance? What are these clues? We're looking to get information that could provide information to us on what resulted in the patient being in this situation. Okay, so excuse. So you encounter a motor vehicle accident. The person is out of the vehicle. You don't know if they've been ejected from the vehicle, but when you stop to help, you see the person sitting on the side of the vehicle. The back facing you. You're not seeing the face. The back facing you. Okay? But you're able to look at the vehicle while approaching the scene and you see the spider pattern on the windscreen and you see some blood on the windscreen, on the inside of the windscreen. Right? What, looking at that or thinking about that simple situation, what do you think potentially happened there?
They hit the head.
The person hit the head. Hit the head on the windscreen. Here's the next part of it though. This is where we go further. What does that tell you about the wearing the seatbelt?
That they probably won't.
They
They weren't
probably
wearing it.
were not wearing the seatbelt. Correct. Now, once you hit the head on the windscreen, taking it further, now this is beyond the level of first aid now. As an EMT, I started to think about spinal injury and the potential for cervical spine injury and the need for inline stabilization and spinal immobilization. Now, as a first aider, of course, you would think about spinal injury, you think about a head injury and all those things. So you may realize, hey, you know what? Stabilization here may be more than what I can provide or more than what I'm trained to provide. But again, you will never know unless you size up the scene. But that is one part of it. You're looking at the scene to get clues on what's going on with the patient. There's something I did not see. And I would like you guys. So the person who did first aid, the person who is functioning as a nurse or want to be a nurse, or as the case may be, in the healthcare sector, I want you guys to stay quiet. I want to hear from everybody else. There's something I didn't mention. We're only speaking about the patient all the time. What do you think is being left out?
Environmental factors like if it rained before or not.
Right, environmental factors, but something even more important than that.
I think
Correct.
you have to
I lost, yeah.
check to make sure the scene is. I think you have to check to make sure that the scene is safe first, that it's not going to cause harm to you or those
That's it.
involved.
Exactly.
I don't
Thank you.
know.
That's it. Your
And
safety.
ma,
Yeah, loud and clear. I hear you. You came back loud and clear now, right? So yes, your safety. We all the time we're speaking about the patient. Yes, it's all well and good to look at the environmental conditions, and you're right about the environmental conditions. But also, we must look at the well-being of you and your safety. Because if you become injured or you contract a medical condition, then it's no good. If you become injured, you're no longer thinking about providing care for the patient. You're thinking about yourself. Okay? So that's part of sizing up the scene. Getting clues, looking at the situation, find out what's going on, and also by assessing the scene, you'll be able to figure out what dangers there are, what potentially happened to the person, um, if you need any additional resources, because you might need fire services to be on site. You might need law enforcement to help provide protection for you. You might need some assistance to move traffic away from you. All those things. But of course, you wouldn't know unless you assess. Excuse me. And what I tell all participants in my programs, first aid, emergency medical responder, EMT, all those programs, take the 2 to 3 minutes or take the 60 seconds to 90 seconds or however long it is and do a proper assessment of the scene. Make sure, because you want to get that level of information in. So if you need additional resources, you can make the call to get the additional resources en route. Okay? If you need some sort of protection for you, then that can happen as well. But you will not know unless you assess the scene. So you assess the scene, so you realize there's one patient, you get to the patient. We always start by asking permission. So I've been an EMT from 2000 to now, 25 years. And every single patient I've attended to always starts with, "Hi, my name is Nigel, and I'm an EMT. Can I assist you?" That's it. Straight off, immediately get permission. Person says yes. Great, thank you. What's the problem today? What seems to be going on? Or the information we got is X, Y, and Z. Is this the case? Or can you tell me what's going on with you? And then you get the long story starting to be rattled out. That's okay, that's not a problem. In between there, you start to decipher and pull out the salient or the critical points. Okay? Protect against disease transmission and looking and employing the use of personal protective equipment or BSI or body substance isolation, as we say in healthcare. Okay? Do we need gloves? Do we need a face mask? Do we need safety goggles or safety glasses? Do we need isolation barrier gowns? All those things based on your assessment of the area, the location, or the scene, as we say. Okay? Right. Determining what's wrong with the patient. Of course, typically in emergency care, and everything with emergency care we're looking at here is pre-hospital, outside of the hospital, right? We see here, before giving first aid, right? Before giving first aid, you must determine what is wrong with the person. So we use this simple term: find it, fix it. It is called an assessment-based care model. That's all. Nice, fine, fancy words for find it, fix it. How are you going to find it? You need to assess the person. How do we assess? We can ask questions. We can physically touch the person to identify parts of the body where there may be issues. Okay? A lot of times it might simply be investigating the person's chief complaint, what they tell you is going wrong, they think is wrong with them. But we're not going to rely on that alone. We're going to assess as well. Okay? We figured out what's wrong with the person. We administer first aid now. Based on what we found, we provide care. And we provide care until one of the events below, well, on screen here happens. Emergency medical services arrive. Could be the ambulance, it could be another person, all these things arrive and they take over care from you. You arrive at a medical facility, so a hospital, a member of the hospital staff take the patient from you, and the patient is now in that person's care. Or it is determined the person only needs first aid and home care, sometimes a minor situation. I will tell you, for situations The really minor ones, such as the band-aid or those things, great, you could treat and release. But a lot of times, I will tell you, err on the side of caution and recommend that the person seeks medical attention. If you've called the ambulance and the ambulance arrives on scene, let the EMTs assess. Of course, you tell them what you found and what you've done. Let them assess and let them provide some information and guidance for the patient. Remember, we even though you've called the ambulance and they arrive on scene, they've taken over care of the patient, they still cannot transport the person against his or her will. The person still needs to say, yes, I want to go to the hospital. But we encourage them, okay? Always in situations like that, err on the side of caution. Call the ambulance and let them provide that information to the patient and make their recommendation. And if the person still doesn't want to go, well, of course, then you can do a refusal of care. Well, not you, but the ambulance personnel, the EMTs, will do a refusal of care or a refusal of transport and have the person sign it. So, first aid competencies, what is critical for you? Being able to recognize, assess, and prioritize the need for first aid, especially if you have multiple patients. Being able to identify, to recognize that, yeah, something is wrong here, or they have multiple persons, assessing each person, and then prioritizing these patients in based on the severity of their condition. Providing care using appropriate knowledge, skills, and behavior. What you've learned, not what you've heard growing up or what you think the person might need. Remember, we follow find it, fix it. Assessment based care. You assess, you find something, you figure out what is needed to help this person. And if you could implement it, you implement it. Now, some situations, the person, in case of major lacerations, the person may require some stitches. And if you're not trained and authorized to administer stitches or sutures, as we say, please don't go looking for Miss Mabel needle and thread in the biscuit tin, the Danish butter cookies pan, and you want to now go and try to stitch and no, 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 no. Nigel didn't teach you that. All right. So I think that is a universal thing, having sewing implement in butter cookies pan. Tell me I'm wrong. We all agree with that? My colleagues, my Caribbean colleagues, is that the same thing in your country?
Yeah.
Hmm. So much so when you open and you actually see cookies, you're shocked. So I actually saw that on social media recently where the person opened the pan and they saw it was all skit, right? They saw cookies instead of sewing implements. All right. Recognizing limitations and seeking additional care when needed. There are boundaries we're not supposed to cross. As an EMT, there are limitations to my treatment. There's only so much I could do. There's a fixed boundary, right? It's called my scope of practice. As a first aider, it's the same thing. And it's in line with what you were trained to do. So we will teach you and we will guide you, provide the information for you to apply direct pressure to a wound and bandage it to help stop a severe bleed. We will not teach you to flush the wound and stitch it. Nigel didn't teach you that. Nigel not going to teach you that. Understand that sometimes the patient's treatment may require care beyond your scope, so you make arrangements to get the additional help. Okay, we clear so far?
Yes,
Yes.
sir.
So I'm just gonna
Yes,
stop
sir.
the share for a little bit. So now I'm just gonna open the floor. Let me hear with what we've covered so far. Let me hear some questions that you guys may have. Floor is yours. Nobody? Nobody has any questions? Everybody fully understand everything so far? Vincent, I ain't hearing you. You okay? You going
Yeah,
good?
I'm good. Yeah.
Soraya.
I
Mm-hmm. Go ahead.
just wanted to know something. If if you run upon somebody who's a gunshot victim,
You run
um,
upon somebody who's a gunshot victim,
yeah,
or you came across somebody who's a gunshot victim.
well, you came across someone who's a gunshot victim.
Right.
Um, well, I was a Marine, right? I was in the United States Marines.
Uh-huh.
They taught us to do what you call a sucking wound, where you put a plastic patch over
Right. So what
the
you're talking about is that pneumothorax, right? For
well,
the chest wound.
yeah,
Right.
yeah.
Uh-huh.
So okay, obviously I have that skill.
Mm-hmm.
If I come across someone like that and I apply, would I be liable for anything if you know? I
Mm-hmm.
just asking.
In Trinidad and Tobago, we will be grateful if you do that because you're actively helping to keep the person alive. And it's within the boundaries of what you were previously trained to do, right? And you functioned in the US military, you functioned as a Marine, and this was part of your training. Nobody's gonna create any issues because you're providing voluntary care. Now, even though so this would be way beyond the level of first. It's actually taught at the first responder level or the emergency medical responder level. So it's nothing where you're actually doing any um internal interventions. All you're doing, and at one point in time, it was taught for first aid. I know it's taught at advanced first aid as well. So you should not be. I don't anticipate any situation where you're gonna be in any problems with that. And all you're really doing is you're creating a flap, right?
Yeah, pretty
That is
much.
all you're doing, yeah, right? So you're okay. You're pretty okay. So thank you for seeking that clarification. Anybody else? You all good? Everybody quiet? Janelle, you have any questions, any comments, any queries, any suggestions?
Not at the moment.
Okay. What about Miss Lancaster, the moderator? Yes, we'll call you the moderator. You okay?
I'm good.
All right. Jidan, you okay? You good?
Yes, sir.
Anjali.
Yes, sir.
Mm-hmm. When you're making out of the flu, you can realize I in a mess, right? Okay, so
Very,
let's see.
very.
Let's see. I'll just share from there in a little bit. All right, so guys, I'll probably do about 10 minutes again. And really, mess up. This cough really killing me here.
Yes, sir. 10 minutes. Good one. Rest yourself, sir.
Oh gosh, I hear you. I hear
I
you. We're actually doing a program with Heritage Petroleum through my business, and I normally hold on until my lead instructor shows up. And this morning, that I wasn't coughing as bad as now. So, um, wow. Okay, so continuing first aid competencies, and we're moving on and getting a little more detail and deciding to help. So, we have a patient, and at some point in time, you're gonna have to make a decision. Do I help this person or not? Okay. And usually what was found, and all this information here would have been based on data analysis, doing research, getting the data, compiling it, making an analysis, and coming up with the recommendations. So we see people are more likely to promptly get involved at the time of an emergency if they have previously considered the possibility of helping others. I will encourage you, please, if there's a situation where you can help someone, help them. A lot of times we've gone on emergency scenes, on motor vehicle accidents, on situations on the roadway where where I've had patients die because nobody rendered aid. Sometimes a simple thing as body position. I'll give you a really, really tragic example here, right? Um, so as you guys heard me telling the law enforcement, the police officer, I live in Vancouver. I live Balmain Village. And when I was working on the ambulance, I was actually working with a station at Vancouver base. We were dispatched a call in, this would have been in Chase Village. We entered the street, got into the side street, and somebody flagged us down. And this was like literally just before the end of our shift. The very last call before the end of our shift. And I mean, some of those calls stay with you, right? This guy was actually going home, but he was drunk and he tripped and fell. And when he fell, he landed in the drain and went unconscious based on the impact. But he fell face down, right? So when he fell face down, he landed there. His face was inside the drain and he was unconscious. This guy drowned in 3 inches of water. 3 inches of water. So look at your finger. Typically, each joint is close to an inch or maybe 1 inch for the majority of people. If you want to get a ruler, look at that, 1 inch, 2 inches, 3 inches. This guy literally, how his face landed, his nose and his mouth ended up in the water. And you remember when you look at these drains, it's not like the box drains that were constructed recently. Those drains previously used something called inverts that had the deepest point would be at the center, so it was beveled walls, right? And how he landed, his face was actually dead center there, and he drowned in 3 inches of water. And what I'm telling you is, when we got there and they flagged us down, people were telling us, well, somebody see when he fall, but they want to get involved because, they're afraid that they get in trouble. I mean, nothing is wrong with just going and assessing and observing, making a judgment call or getting the appropriate information. And that was really, really tragic. Because this guy, I mean, yes, he went, he drank his rum. And I mean, we all adults. You want to drink, you drink, no problem. Just don't cause no issues, right? Unfortunately, this guy died because of a situation as simple as that. So that's why I encourage you, if you're ever in a situation where somebody needs help, please render aid. Even if it is simple as calling the ambulance. You're driving, going up the highway, and you see a vehicle run off the road, you're unable to stop, or you're traveling in a taxi, excuse me, or you're in a bus, whatever it is, whatever transport means, take your phone and call for help. And you can tell the dispatcher, look, I'm in a bus going down the road. We just passed this accident at such and such location. I don't know what's going on, but the call is logged, and of course, they will send somebody to investigate. Okay, so please, please, if at the end of this program, at the end of this semester, I could actually get one or two of you all to make that change and to be serious about that, then I am happy. Because a lot of people take the information and they say, yes, we'll do it. And when the situation happens, or if they're ever in an emergency situation, nobody helps. All right, let's continue. So to develop a helping attitude, we want you to be able to understand the importance of helping. Think about, and to do that, we tell you to think about if it is you or if it is your relatives who need assistance. Would you be grateful for this help? Feel confident about helping, even if someone else is present. And this can only happen through practice. Okay? Be willing to take the time to help. In this society where everybody going about their business and concerned about getting to the location on time as quickly as possible, you make that decision to help, you have to see it through. Be able to put potential risks of helping in perspective. What are the risks? Could I be injured? Could I contract an illness? Can I be assaulted? What dangers are there to me? And this is where the scene survey comes in. Feel comfortable about taking charge if needed at an emergency scene. And sometimes some people shy away from that. If that is the case, then no problem. But if you know what to do, you can always suggest it. Or you can let the person know the loudest mouth know, hey, look, I know first aid and you want me to help, or I would like to help. Okay? Um, Feel comfortable about seeing a person who is bleeding or vomiting or who appears dead. If you know you cannot see a person in this condition, then by all means, call somebody or get somebody who could do it. Sometimes that's just how we are. No particular reason. Some people they get all woozy and queasy and the stomach starts to feel real weird when you see blood and suddenly they want to pass. So that's some people naturally like that. Just like how some people are claustrophobic or some people get seasick, nothing is wrong with that. And don't beat yourself up, don't blame yourself. But there are other things you can do to assist somebody in need. And I would encourage you to figure out what else you can do. Okay? Communicating calmly. Provide comfort and reassurance to the person you are helping. Sometimes as simple thing as talking to them. Talking to them in a nice, calm manner, letting them know, hi, look, I call the ambulance, they're on the way. Let me see what else I could do to assist you. Sometimes people in these situations just needs to know that somebody is there to help them. Use these guidelines for establishing a relationship with a responsive person that has an injury or illness. Get the person's name and use the name while you're providing first aid. Your first words to a person are very important because they set the tone for your interaction. So if you walk up to the person and say, hey, Mamu, what's going on? Person what you like, okay. A lot of times, and this is where our country differs from other parts of the world, and I will not just say the US, but other parts of the world. Um, excuse me. Typically, we normally refer to everybody as uncle, auntie, bro, pal, or as the case may be, right? Nothing is wrong with that, and it helps to build that rapport with the person. In other parts of the world, it may require you to be very formal, sir, ma'am, as the case may be. Okay, but here in Trinidad, that's okay. It's not a mandatory requirement to address the person in that manner. Using our local terms actually helps the person feel more comfortable around you. Avoid negative statements that now let's go back to the first words, right? You approach the person, you see the person sitting on the side of the vehicle, and you're like, where you alive, boy? I swear somebody dead the way I see that car mash up. What do you think the person is gonna have going through their minds? Tell me, what do you think? Let me hear your
that,
comments.
that they're gonna die.
That they're going to die. Anybody else? Tell me, anybody else?
You might give the sensational manner might make them feel you really don't care, just want to see.
Ah, that's right. And you come out with your phone. So suddenly they're thinking they're gonna be all over social media, right? So be mindful of that. And what we found now is a lot of people prefer to put things on social media instead of helping. Please don't be one of those persons. Avoid negative statements that could add to the person's distress and anxiety, which is part of what I just said, right? Do not ask unnecessary questions unless it aids treatment or satisfies the person's need to talk. Stick to the point. Stay right there. Find out about the situation and try to figure out whatever else you could do. Don't ask them about where they, where they're working, how much money they're working for, how much they pay for this car. All right. No, no, no. You see the person, there's a young lady in the property with the patient. Is your daughter hurt? How old she is? Mm-mm. Totally, totally irresponsible and irrelevant. And I'm telling you that because they're having people who would have asked questions like that, right? Questions that are irrelevant. Give realistic answers to the person's questions, but try to be positive. If you're not sure, say you're not sure. But I've called for help. Help is on the way, and they will assist you further. Do not make a promise you cannot keep. So we see here, for example, instead of saying you will not have any pain, say the worst is over. Be honest with the person, be open. If you know you're going to stabilize a dislocated shoulder, let them know, hey, I'm gonna stabilize this, you're gonna get some pain while we're doing it, but once we're finished, it's gonna ease up the pain significantly. Okay? I mean, there's an injury, it's gonna be painful. Do not deny the obvious. For example, instead of saying there's nothing wrong, say, you've had quite a fall and probably do not feel too well, but we're gonna look after you. Be honest, look, this is the vehicle was in a major collision. And I believe you need to see the doctor, and I've called the ambulance, let them carry you to the hospital to be assessed. Don't tell them, well, hey, I swear you going and I coming to meet somebody who dead here. No, no, no. That's not necessary. Discuss the person's condition calm and honestly explain what you're doing and why you're doing it. I mean, that's self-explanatory. What you're doing, why you're doing it. When you're bleeding, you apply a bandage to help stop the bleed and stabilize you. When you apply a sling and a swat to stabilize a dislocation, you put a splint for a suspected fracture. Okay, you put them to sit down, loosen tight clothing to ease the pressure on the chest so they could breathe easier. Encourage the person to express their feelings. Listen, but do not judge. To ask them if they want to talk about it. Because sometimes the person speaking and expressing how they feel after a while can help to calm them down. Okay? Tears and laughter, all laughter can be normal. Let the person know this. If such responses seem to make them feel embarrassed, let them know that's okay. I went on a call in Shogunas on the highway, an accident. And I remember this call because the young lady actually lives about 2 minutes from by me. Her dad is a pastor. So growing up, we knew the house, but we never saw anybody. And we knew somebody's living there, but we never saw anybody in the yard or anybody coming out or anything like that. So whilst attending to the patient, she said she was from my village. And I was like, well, I live in here. I don't know you. And she started, oh, okay. And then I realized that was her dad was actually a pastor and stuff. So while talking to her, I realized tears forming in her eyes and those things. And I tell her, I said, look, if you need to cry, cry. Don't keep it bottled up. And right there, that was just the invitation she needed. Everything came out. And then, of course, I asked if she needed to get in contact with anybody. And she said yes. So she had her phone. And I told her, I said, we have no equipment here that would be affected by using your phone. Feel free, call your dad, call your mom, somebody. And those simple things make a difference in the developing that rapport with the person. Okay? Providing competent care. You know what? I think I'm gonna stop here. All right, so let me just stop the share. I will stop the recording.